Okay, so in this video we'll be looking at the appendicular skeleton, and here we have the clavicle. Alright, so you can see it's a little wavy S-shaped bone. The one side is a little bit flat, the other side is more blunt-ish. Alright, and that's your collarbone. Now here we see the scapula. Now the scapula, the shoulder blade, we can see this from the posterior view, and then the anterior view where it would sit against the rib cage. Now the scapula has many fossa. So a fossa is an indented area, so there's a fossa here, there's a fossa on top, and there's a fossa in the front of the scapula as well. Now the structures that we want to pay attention to are this huge ridge of bone here. This is the spine of the scapula. This flat area right here is the acromion process. And then we see this shallow articular surface known as the glenoid cavity. Now the glenoid cavity is part of the shoulder joint. Now the other part of the shoulder joint is from the humerus. Alright, so here's the head of the humerus. This makes up the ball of the shoulder joint. We call this a ball and socket joint. Now, this right here, this area right here is known as the greater tubercle. Okay, so the greater tubercle is this kind of bulging area right in here. Alright, that is the attachment site for all of the rotator cuff muscles. On the lateral surface of the humerus, we have this kind of rough area right in here. This is the deltoid tuberosity. On the distal end, or distal epiphysis of the humerus, we have this large bony projection here. This is known as your medial epicondyle. Okay. Now the two bones in the forearm, we see the radius and we see the ulna. Okay, so here's the radius and the ulna. Now, with the radius, we see the rounded, blunt head, and this is the neck right in here, and this large bump is known as the radial tuberosity. Okay, so head, neck, radial tuberosity. Now, the distal end is where we see the stylus of the radius, and this is what is going to help to form part of the wrist joint. Now with the ulna, we can see that it has a very pronounced hook-shaped end. Okay, kind of like a hook. All right. Now, this right here is where the elbow joint is going to be. The elbow joint is a hinge joint, and so in that hook, that's where that hinge joint would be. Now the end of the hook right here, all right, so this part right here is going to be the olecranon process. All right, that's the tip of your elbow, the olecranon. Now the distal end of the ulna is very tiny. It is the head of the ulna with a little point, again called the stylus. Now when we look at the hand, okay, so we see many, many bones in the hand. Now, we start looking at the wrist bones, the carpals. Okay, so this is the thumb, so we always start at the thumb side, and we can see the different bones here in the wrist. All right, so we have the scaphoid, the lunate, the triquetrum, and then on top of that is the pisiform. Now the pisiform is a little bit hard to differentiate. It sits on top of the triquetrum. Okay, so this is the pisiform. Okay, that's the first four. Now the second four, we have the trapezoid, the trapezium. Okay, so trapezoid, trapezium, hamate. Okay. I'm sorry, capitate and hamate. So I got to turn this just a little bit. Okay, so trapezoid. Let's go through that again. Trapezoid, trapezium. Then we have the capitate right here in the middle. And then the hamate, which looks like it's got a little hammer handle right there. Okay, so those are the 8 bones of the wrist. Now the bones that make up the hand, or the palm of the hand, are called the metacarpals. So we have this one here at the base of the thumb, And then we have the 4 that make up the palm, okay, 4 metacarpals that make up the thumb. These bones are the ones that are articulating with the carpals. Now in the fingers we have the phalanges. All right, we have phalanges in the thumb, phalanges in each of the fingers. In the thumb we have 2, proximal and distal phalange. In the fingers we have the proximal, middle, and distal phalange. So there's 3 in each finger, only 2 in the thumb. And that is the upper body. Now, when we're looking at the lower body, we start with the pelvic girdle. Now, the pelvic girdle is made up of 2 pelvic bones. Okay, so we have 2 pelvic bones, and we have the sacrum, which we talked about in regards to the axial skeleton. So those 3 bones make up the pelvic girdle, sacrum and 2 pelvic bones. Now, from the top down, we call this the pelvic bowl. And if we look at it from the bottom, we call this the pelvic outlet. Okay, it kind of makes sense because stuff comes out there, right? Now in the front, between the 2 pelvic bones, we have this joint here known as the pubic symphysis. Okay, that's the joint between the 2 pubic bones. Now, each pelvic bone is made up of 3 smaller bones. Okay, so here's a right pelvic bone. This top half, all right, so this top half is called the ilium. The bottom anterior is the pubis, and the bottom posterior is the ischium. So we have the ilium, pubis, and ischium, the 3 bones that make up each pelvic bone. Now, the pelvic girdle is one of the most definitive ways that we can tell the difference between a male and a female pelvis. We look at this area between the 2 pubic bones known as the pubic arch. Okay, so here's the pubic arch. All right, and we look at the outlet. Now with a male, the pubic arch is very pinched or narrow, and the outlet is occluded. Okay, so this one's broken, so it's a little bit harder to see how occluded it could be. And the coccyx seems to be missing. With a female, the arch is going to be very broad or wide, and the outlet is going to be much wider. Now, when you look at the female, again, you can see how broad the pubic arch is. Okay, how broad the pubic arch is, and then how unoccluded or open the pelvic outlet is. Okay, so that's the difference between a male and a female pelvis. Now, the structures that we see here on the pelvis that you're responsible for, we have this area here. This is the ASIS, this bony point. The ridge is the crest. The socket here is the acetabulum, and that's the socket for your hip joint. We have the pubic symphysis. And then down here, this rough area at the bottom, that's going to be what we call your ischial tuberosity. That's what you're sitting on. Okay, so that's what you sit on. So if you looked at that, you're sitting down, you're sitting on those ischial tuberosities. Okay? Now, the other bones in the lower leg, we have the femur. Okay, so here's the femur. The head of the femur, we see a very rounded articular surface. That's what's going to fit into the hip socket or the hip joint. Okay, very nice, very solid, very secure. Okay, very different from what we see with the shoulder joint. And so we have the head of the femur, the neck of the femur, which is the most common location of femur, is broken when someone has a broken hip. And then with this large bony protrusion here known as the greater trochanter. Okay, so greater trochanter. Now down the diaphysis to the end here we see the condyles. We see the medial and lateral condyle, which helps to form the knee joint with the tibia. Okay, so here's the tibia, the larger bone in the foreleg, and together these form your knee joint. Now the other bone that we see here at the knee joint helping to protect the knee is the patella. All right, so the patella sits in front protecting the knee joint, but it's not the knee joint itself. It's embedded into the quadriceps and patellar tendons, and so it's the only bone in the body, or one of the only bones, that is held on by a tendon, not a ligament. Now, when we look at the tibia, okay, so we see the tibia. This portion of the tibia is what forms the knee joint. And then we have this bump right here known as the tibial tuberosity. The anterior part of the tibia is known as the crest, the anterior crest. And then the distal end of the tibia, we have this kind of large bony protuberance here. This is called the medial malleolus. Okay, so medial malleolus. Now that malleolus helps the tibia stay on top of your ankle bones, help form the ankle joint. Now, the other bone in the foreleg is the fibula. Okay, so the fibula is going to articulate with the tibia, but notice how the fibula does not form the knee joint and thereby is not weight-bearing. Okay, so your fibula is not weight-bearing. So we see the head of the fibula up on top, and the distal end is what we refer to as the lateral malleolus. All right, now the medial malleolus and the lateral malleolus are going to cup the ankle bones, forming the ankle joint. Okay, so the bones here that form your ankle joint are the tibia, the fibula, and the top of the ankle known as the talus. Okay, so the talus is this top bone here. Then we have the calcaneus, which is the heel. And then we have the other bones that we see here. We have the navicular, we have the three cuneiforms, and the cuboid. Okay, so these are the bones that we see in the ankle. Now, the bones that make up the top of the foot, we have the metatarsals. We have 5 metatarsals. These are articulating with the tarsals. And then the toes are formed by the phalanges. 2 phalanges in the big toe, 3 phalanges in each of the smaller toes. Even the pinky toe, the little toe, has 3 phalanges. Proximal, middle, and distal phalange. All done.